Good evening. Welcome again. This is October session of Senior Living in Alexandria. We're glad to be with you this evening. As we've done in previous months, we're trying hard to give good information to seniors, but also to family and friends in Alexandria. I'm joined this evening by my colleague, Mary Lee Anderson, who's Executive Director of Senior Services of Alexandria, and I'm very pleased to have with us Mr. Bob Blancato. He's president of AARP in Virginia, and he's going to be here to tell us a little bit about AARP. I know it's the big gorilla, but we need to understand a little bit more about it. But in particular, he's going to focus on us tonight for something that's a concern for all of us in terms of long-term care. So we'll come to you in a second. But first, Mary Lee, a lot is going on. What's up with senior services?
We are having a very busy fall, Jim. We started out our speaker series last month with a program over at the Animal Welfare League on Eisenhower Avenue talking about senior pets and all the programs that they have over there, but especially about a new program that we're offering in partnership with the Animal Welfare League that we call Animeals on Wheels. We deliver pet food, dog food and cat food, to lower income seniors every month. And we have more volunteers than we have clients right now. So we're hoping that we'll get some more seniors who could use a little bit of help in getting pet food for their animals. And so we're very excited about that. And then also we are offering Meals on Wheels to people too, of course. They can get it through the Division of Aging and Adult Services if they're homebound. But if they're not homebound and perhaps have a temporary need for Meals on Wheels because they've had surgery, or if they have a chronic medical condition that makes it tough for them sometimes to do their shopping and cooking, they can come to us and get Meals on Wheels directly from SSA for just $10 a day.
So you've expanded your coverage to a new population of people that might be in need. Well,
Exactly,
that's
exactly.
good news.
Yeah, we're very excited about it.
We did Meals on Wheels a couple of weeks ago, and that's a great program. So
It really
good
is,
that you're making available for other people.
Yeah.
Well, let's turn to Bob. Bob, tell us a little bit. Those of us that have gotten over 50 years of age have gotten the card in the mail that's automatic. How you find us, I don't know, but we get the good news. We're now eligible for AARP. The audience may not know the breadth of AARP. I'm sure they've had that experience, but tell us a little bit about AARP, and then we'll focus in on the long-term health situation.
Thanks, Jim, for having me on the show.
Sure.
And AARP is, you're right, it's a big operation. It serves well over 30 million people. You get that card, use that card. It offers you discounts, it offers you opportunities to travel and do a lot of really good things. But AARP is really driven by a social mission to make life for people 50 and over as meaningful as possible.
Okay.
We have programs like Life Reimagined, where you can take your own self and examine what you might want to be doing more as you get older. So you have opportunities to contribute to your community throughout your lifespan, which a lot of older people want to do. We take public policy issues, we defend the rights of older people to be protected from Social Security cuts and Medicare cuts. And we also do local programs. I'm the state president in Virginia, which is a wonderful volunteer job that I encourage people to think about, offering things like tax aid preparation, driver safety programs, and then our Home Safe program. You know, our favorite saying is, you know, it's not you that's getting old, it's your house that's getting old. And you need to make the necessary changes in your home to make it safe so you can age in place very comfortably there.
Now, on long-term health care, tell us a little bit how AARP or State of Virginia, from your position, what's the need? What kinds of problems or issues, and then how does AARP try to address some of those?
Well, long-term care as a national issue is a huge issue. It's actually America's denial issue. We just pretend that it really doesn't exist. Yet we have a growing population of people who need long-term care and services. We spend $182 billion a year on long-term care, and that number is going to double by the year 2030, because we have, you know, people with different levels of care that are necessary. But long-term care really is not just nursing home care. Long-term care involves the full gamut of supports and services that people need, whether assisted living or home care, respite care, care coordination. And the discussion, happily, after all these years, is moving away from that narrow focus on just nursing home care to a broader discussion of what is needed at the home and community level to keep seniors independent and being as comfortable in their lifespan as possible.
When you talk about long-term care, where's the border between a trip to the doctor, outpatient surgery? At what point do you begin to kick into the idea of long-term care?
Well, a lot of it's going to depend on whether you have a chronic illness of some kind or another, and that's going to require more attention over a period of time. You know, the long-term care can be, you know, related to periods of time after, you know, an injury of some kind, or it could be dementia that requires a certain level of care going forward. But what we don't have in this country is a national long-term care policy. We have a Medicaid program that provides 49% of all spending on long-term care, but you have to spend down your assets and become poor to become eligible. Medicare does very little for long-term care, even though a lot of people think it covers long-term care. We need to really go back and look at the basic elements of what long-term care is about. It's a public-private partnership we need to put together. Okay, the private sector has a role for people who need long-term care insurance and other products of that nature. You know, the very poor should have Medicaid, and that's the goal. That's the role of the government, to do Medicaid. And in Virginia, as you know, our big top issue is trying to get Medicaid expanded for 400,000 low-income Virginians who need that coverage. And what people don't understand oftentimes, particularly the opponents of it, is that, yes, the federal government will cover 100% of the cost of expanding Medicaid in the first 2 years. The state must kick in something in the third year, but Medicaid expansion creates 30,000 jobs just in the state of Virginia, which would more than offset the need and the revenues that would require to do Medicaid expansion. But it's about a broader look at a lot of programs. Mayor Lee knows about the Older Americans Act and the great programs that that has. That's a home and community-based long-term care program. It's just not called that. So.
In the role of AARP in this, as I'm hearing it, is conduct research, be an advocate, design and screen programs that might be quality programs, do assurance of quality in programs, and try to do education. Is it all those roles in terms of AARP?
All those roles, and AARP is going to be embarking on a major new initiative around long-term care and caregiving in the coming months, because they are interrelated. You don't have long-term care without someone providing care. 44 million families in this country have some caregiving responsibility, and it's time we gave them the support they need to be able to do their jobs correctly. But AARP cares about the workforce. We must have more people in the workforce to care for an aging population. We need to be addressing how to build stronger community services so people who prefer to stay at home can age in place better. So there's a lot of pieces to it. And you know, the Affordable Care Act, you know, had a long-term care provision in it, but it got repealed because of a variety of reasons. But AARP still cares deeply about long-term care and caregiving, and that'll be shown in the coming months.
It seems to me it's not just an issue for seniors.
Right.
It's a family issue, it's an economic issue, it's a national issue that, you know, our parents or our children equally want to look into long-term care and maybe be relieved, at least understand the responsibilities, but maybe clear on what the burdens are and what programs are that might be available.
Well, it's very important to point out that long-term care is about planning. Planning for the future.
Okay.
And knowing that, you know, finding ways to protect yourself from, and the average cost of a nursing home is $82,000 a year.
Ooh, okay.
So, you know, you need to have a certain amount of protection in there. So, for example, the federal government, federal employees, active and retired, as well as active and retired military personnel, have a long-term care program called the Federal Long-Term Care Insurance Program.
Okay.
They pay a premium for it, but they get a range of services that give them a buffer against those high costs that you can run into. But it's about planning. You need to think ahead about what's good for you to do.
What are the consequences of poor planning? Suppose you ignore it totally as an individual, or then in terms of the society or the economy. What bad things happen?
Well, I mean, if you find yourself having to be, you know, institutionalized because you didn't maintain a proper diet, that's really a waste of resources, and it's also not good for you as an individual. A home-delivered meal, one day in a hospital, you can feed a person a home-delivered meal for a year. So if we invest more in local and community services that are preventative in nature, we can save the problem of having people go into nursing homes where they don't want to be, or assisted living where they might want to be. It's all about building up the strongest possible home and community-based services so that people have a continuum of care, and if they have to go to a hospital They don't have to get readmitted after less than 30 days because they have the services available to them. So that's what we have to be focusing on.
You mentioned the word denial. I think that's the easy answer. What's AARP doing to help create awareness and therefore maybe some motivation for action?
AARP does public education as well as any organization in this country, and they're going to be focusing a lot of attention in this long-term care caregiving initiative around public education and awareness.
Okay.
Make it a kitchen table conversation, which it should be. Okay. And I'm very confident it'll be good.
You mentioned a particular concern in Virginia in terms of the Medicaid issue that's been in front of the legislature. Are there other things that are unique in terms of long-term care in Virginia in terms of your office and your responsibilities?
Well, we're also seeking to get expansion of home and community-based services in Virginia through the Aging Network and the Older Americans Act. We're trying to cut back on the problem of financial exploitation of older people. And by the way, elder abuse is a related issue to long-term care, because if you are not safe in your community, you become a victim of elder abuse, you are 3 times more likely to end up in a hospital and 4 times more likely to end up in a nursing home. Okay. So when we talk about elder abuse prevention, we are talking about a preventative measure that's very important for older people.
Okay. You mentioned that you do look at companies and make some judgments as to the quality of care that they provide. What criteria or what do you hunt for in making those judgments?
Well, I think I'll speak more as an individual on that, because I don't know, AARP has its own approach in this, but I think as a taxpayer, as a common sense thing, you should be looking at what a company offers. If, say, you're looking at long-term care, what's available in their policy? How long have they been doing this kind of work? What is their track record? Or they have a good consumer education component in their work? If these things, the answer to that is yes, then you continue to have that conversation. But if they have a tendency to walk away from their customers or stop adding new customers to their base, then that may not be a good place to go. But the educated consumer is very important in this discussion about long-term care and coverage, and I hope we can do that as a nation.
Are there other aspects that are unique to Virginia, in addition to maybe strong awareness, and advocacy?
Well, Virginia is a wonderful state. We're proud to have over 1 million AARP members in the state. But we have to recognize that the needs in a place like Big Stone Gap and the rural part of our state and in Northern Virginia are completely different. So what we have to do is have common language and understanding about how to educate people about getting older, but getting educated about getting older well and getting the most out of life. And I think that's what AARP is working to do as an organization.
It seems to me that we stumbled through the long care selection process, which is all kinds of variables in terms of insurance policies, and it was frankly not a pleasant nor an informed experience. I guess my question is, what resources are available to folks like us that want to sort out what do we need to know, what do we have to worry about, what do we have to concern, how do we make good choices?
That's a very good question, and I would add one thing. A lot of times people wait until the crisis is on the doorstep before they do something. And that's when you have that kind of situation, you're not thinking straight because you're under a panic situation.
Planning,
right,
which is essential.
It's about planning. So, I mean, I'll start with my organization. If you go to aarp.org, you'll find a lot of information about long-term care.
Okay.
But if you go to longtermcare.gov, from the federal government has a good site that gives you a lot of information. And then from a consumer perspective, if you go to the National Association of Insurance Commissioners, NAIC.org, they also have wonderful resources that you can go to and get the best information on what products are available in the marketplace.
Okay. It's kind of scary when you think about it if you don't pay attention to it, both from, again, society and economy, but from a personal standpoint. What do families need to know? What do they have to, what do my children, I'm disabled, I can't make decisions. How do they go? Obviously, they can go to the same sources. Is there something else that they might do by way of preparation?
And every family situation is different, but it still involves around planning and communication. And we have to improve the level of communication between parents and kids in this country about those very issues, about aging, okay? It doesn't have to be a negative conversation, but you have to have basic conversations about planning ahead.
That they know what your what the person's preferences are, what their choices are, and can they afford it?
Yeah, can they afford it? And can they stay in their home? If they want to stay in their home, that's fine. But you have to make some modifications to it. Then think about that. And all those things are important. But communication is important, but being educated is also very good too.
Okay. Well, unfortunately, this is a long topic and complicated, but we're running out of time, and I'm sure there's other questions we could ask, but you've given us a lot of information in a short amount of time, and really appreciate it. So we're going to take a break now, and we will be back very shortly.
Hi, I'm Mary Ann Beatty with Senior Services of Alexandria, and we're back in Inova Alexandria's kitchen with Chef Hans. Hi, Chef. How are you?
Hi, Mary Ann. Welcome back.
Thank you. So are we going to do a little something with tomatoes
Let's
today?
cook with tomatoes.
Good. Yay. All right. What are we going to do first?
Well, the first dish I'm going to make is what I call a pasta cecca.
Oh.
And a cecca is basically a raw tomato sauce. And so we're going to make a pasta dish with some fresh tomatoes. And it's kind of not like your regular marinara where you cook the sauce ahead of time.
Right.
Should I get started?
Yes.
Okay.
Yes.
First thing you always want to do is we're going to get our pan good and hot.
Yeah.
And I'm going to spritz it with some olive oil, extra virgin olive oil.
All righty. Good for your heart.
Yep. And then some garlic. Remember last time you were here, I told you not to be a garlic weenie? Yeah. So we're back to that.
And I see that. I know.
When you cook with garlic. So all I want to do is get a little color on the garlic.
Okay.
On the garlic.
All right.
And get the pan good and hot.
Yes.
And then once that's going, we're going to add some fresh tomatoes.
Oh,
Let me call your attention to what beautiful tomatoes we have in season right now.
Wow! Explain the different ones we have.
Well, we got some yellow ones. We've got these are like our regular tomatoes.
Yeah.
And these are purple Cherokees. And I don't recall the name of this one.
Okay, all right.
But they're all beautiful. They're all different.
Oh, it's
and they're
wonderful.
that perfect texture where they just have full of bursting with flavor and juice.
Wonderful. I'm not familiar with the Cherokee. I don't know about that.
You'll see most grocery stores have them, and some of the stores I've been to, they're growing them hothouse all year round.
All right.
But these are fresh, local here from Virginia.
Oh, great. All righty.
So I've got a little color on the garlic.
Yeah.
So I'm going to let it sit like that. Then I'm going to add some of my pasta, and I've got whole wheat penne pasta.
Okay. We're eating very healthy.
Of course. Whole wheat penne pasta. So you'll notice that I don't have any liquid going on in here.
Right.
Because I know that I've got to have a lot of liquid coming off of the tomatoes.
So this is dry pasta.
Cooked.
Cooked?
It's already cooked.
Cooked, okay.
Yep.
All right, okay.
So cooked pasta. Then I'm going to add some of my beautiful tomatoes. Just a little of each kind.
Oh, pretty.
Remember, I said this is going to be called a raw sauce.
Yes.
So I don't want to overcook it.
Okay.
Some fresh basil.
Ooh. Oh, that looks yummy.
You smell the fresh basil coming off of there already?
I do.
I've got a plate.
Well, that's easy.
Yeah.
Oh, yeah.
I've got some fresh mozzarella to go on top.
Of course.
Just a little bit. When the fresh mozzarella goes in,
Yeah.
that's basically done. I don't want to cook
Okay.
it too much more with the fresh mozzarella.
Oh, how wonderful. I'm going to turn your oven off for
Yeah.
you. Okay, I'll do that. Oh,
Fresh
perfect.
pasta alla cecca.
Oh, that's so wonderful. Can I taste it?
Yep, I've got spoons.
All right. Perfect. Oh, thank you.
You got two there.
I do have two. Oh, let me just see. Yummy. Oh, that's really
You get that bright, fresh flavor.
Uh-huh. Oh,
And the beautiful thing about it is, we don't need to make spend 2 hours making a marinara sauce.
No, it's perfect. Oh, thanks for sharing that.
Welcome back. We're going to wrap up this session. I want to thank very much Bob Blancato, who's Pin here with us from AARP, president in Virginia. We're going to go to highlights of the September Speakers in Senior Services series on the Animal Welfare League in Alexandria. Seniors have pets, and that session will tell you a little bit about it. So Mary Lee, anything else that we've missed this evening?
Well, I did want everybody to put on their calendar Saturday, October the 18th. That is Senior Law Day. And we're actually going to be talking about long-term care as well as the really important issues that everyone needs to plan for estate planning, legal issues, financial planning, and really focusing on long-term care. And we will have a speaker from AARP there. So I hope everybody is able to join us at the First Baptist Church on King Street, Saturday morning, October the 18th.
Every year you host one Senior Law Day, and it is absolutely chock full of useful information. So we're looking forward to that, and we'll see you next time. We look forward to it. Take care and be safe.
One of the programs that we've been working on is our work with senior animals. So this is Satchmo, who is a 12-year-old Chihuahua. And we have a program here for seniors, senior animals that are 8 years or older, so cats, dogs, anything, or can be adopted by a senior who's 65 years or older for free. There's no adoption fees at all. And we do that because we truly believe that it's important for us to find companions for these guys. And seniors, everyone who has an animal really benefits from them. And it's a truly source of inspiration in people's lives, improves health. There's been tons of studies on how it can reduce depression, reduce heart attacks, blood pressure. All of these things that we get concerned about as we get age are things that animals can really help us with.
Today I'm going to talk about Animeals. We have a large volunteer corps and we deliver meals, and we're good at delivering food. And the Welfare League has a lot of food and a lot of surplus, and there are a lot of seniors out there with pets, so it was just a natural fit that we would deliver and work with them on delivering meals, and meals for pets, cats and dogs, once a month. So we deliver dog and cat food the second Thursday of every month to cat and dog owners. And it's either 7 cans or 10 cans or 10 pounds of food. And we've got about 13 or 14 clients, and we're hoping to expand the program. So there are flyers. The eligibility is 60 and over, a senior living in the city of Alexandria. Hi, I'm Mary Ann Beatty with Senior Services of Alexandria, and I'm pleased to be here with retired Colonel Tom Christensen, who is with the senior historian with the Office of Secretary of Defense Historical Office. Colonel Christensen is going to talk to us about the upcoming events that are commemorating the 100th anniversary of the beginning of World War I, the war to end all wars. And we're going to find out what's happening in Alexandria and learn all about Colonel Christensen. Thank you for being on our show.
Thank you for inviting me.
Yeah. Well, first of all, tell us a little bit about you and what the celebration and what it entails.
Sure. I'm a former colonel from the United States Army. I retired in 1997. I'm fortunate to be a committee member of the sister city committee, Alexandria and Caen, and therefore there is a French connection, and that's one of the reasons why we're giving this on the first week of November, which also commemorates what we call Veterans Day, but in Europe is called Remembrance Day or Armistice Day, because that's when World War I ended. And so as part of the sister city, Caen and Alexandria, I'm giving this presentation at the Lyceum on the 5th of November.
Great. So what will the presentation contain? What will you be telling the audience?
Basically, it's a remembrance, what I call Remembrance Day, but I'm going to be talking about, in particular, the great French contribution to the war because of our sister city status with France. And many people look at the French as, because of what happened in World War II, as giving up to the Germans and things like that, without understanding the incredible sacrifice that they had went through in World War I, where 1 million, almost 1,400,000 French soldiers died in World War I. More than 5 million were injured, and of that total, 60% of all French soldiers who participated in World War I were either killed or maimed, meaning they lost a limb.
Oh boy.
60%.
Wow.
75% of the entire total that participated in the war were killed or wounded.
Oh boy.
So it's an incredible
yeah.
sacrifice, and
Yes.
people need to understand that. And then the second half of the participation is going to talk about how the Americans came in 1917, because we don't join the war until 1917, and basically get there just in the nick of time as the French are buckling because of the high casualties. The Americans get there literally within days and weeks of that final German attack that is within range. They're actually shooting into Paris with their large cannon and save the day type of thing. Just as a comparison, though, as far as casualties, the American contribution was enormous and certainly was the tipping point. We took 117,000 American soldiers died in World War I, but that was only 8% of our population was killed and wounded. Again, compared to the French, 75% of all French men between the ages of 18 and 28 were killed or wounded.
Boy, I don't think too many people
it's
know
an
those
incredible
statistics.
statistic.
Yeah, absolutely. Can you give us the details of when it will happen again?
Yeah, it's going to be on November 5th at the Lyceum in Alexandria in South Washington.
Yeah.
And the presentation starts at 7 o'clock, but there's going to be wine and cheese at 6:30.
All right.
There's a $5 charge.
Okay.
We're going to waive that charge for certain groups, considering retirement groups and things like
Veterans,
that. But we would be happy that if there was a good attendance. We've done some D-Day commemorations also and had very, very good attendance. We anticipate a good showing also at this.
And so how would people RSVP or get in touch with
They don't need to RSVP, but they can go to the Sister City website, and that should give some information about the presentation also. Again, the 5th of December, or excuse me, the 5th of November, which is Remembrance Day weekend, because the war ended on the 11th of November at 11 o'clock, which is 11/11/11 if you think about it. So it's a good time to remember those soldiers. And in the Lyceum, there's a soldier from Alexandria, his uniform and helmet and things like that. So people could go anytime and see that. So it's quite interesting.
Well, thank you for letting us come here
Thank you.
today. And we will make sure that we get the information out across town. And thanks so much again.
Thank you, ma'am.